Let's bring in Dr. Jane Morgan, cardiologist and Vice President of Medical Affairs at Hello Heart. Jane, thank you for joining us, Doctor. Can you explain to us, first of all, what Lyme disease is and how it's contracted?
Yeah, thank you, Brian, for having me. Lyme disease is more common than we think here in the United States, especially up in the Northeast corridor and somewhat in the Mid-Atlantic. And even though it's present in all 50 states, that's really where it's the most prevalent. And you are bitten by a tick, a small black-legged tick. You will be unaware. It's painless, and the tick transfers this bacteria to you that causes Lyme disease.
Okay, so what are then some of the most common symptoms, doctor, and how is it treated?
When we talk about the symptoms, Brian, we're really talking about things like fever, fatigue, joint pain, but it also has that really telltale rash. We call that the bullseye rash, where there's a center and then a clearing and then a circle around it. It looks like a bullseye. It can be any number of sizes from very small to very large. And that telltale rash really heralds Lyme disease. Treatment is usually to address it with antibiotics like doxycycline or amoxicillin. But it looks here as if Justin Timberlake may have gotten a late diagnosis because he seems to have more progressive neurologic symptoms, those nerve pains and fatigue and joint issues that he's talking about.
Okay, so finding it early is what's going to hopefully prevent it from being extreme later on. Dr. Jane Morgan, really appreciate your expertise. Thank you for joining us.
Thank you, Brian.